told, Mr. Speaker, that in the last 7 years, there has been an investigation after investigation of importation of sugar, sometimes even eating the country being forced to partake of sugar that is substandard, Mr. Speaker, because people who are being granted importation licenses and they were fetching for sugar from across the world, Mr. Speaker, some of which is not even fit for human consumption. But for the very first time, Mr. Speaker, we have enabled our farmers to be able to keep our factories busy and be self-sufficient in terms of the demand for us as a country, Mr. Speaker. And for a long, long time, I haven't seen people fight for those permits to do importation. That's very good progress, Mr. Speaker, and I must appreciate and urge that more be done even in this sector. It is actually possible for us to have a surplus and feed the other COMESA countries, Mr. Speaker, so that our farmers, Mr. Speaker, in the sugarcane growing areas, through this promise of working to ensure that we provide the needed input to put more than 500,000 acres of land into active use, Mr. Speaker. Actually, 500,000 is what has already been brought, but there is need to do more. As in the coffee subsector, reported in that particular part of the speech, we have more than 48,000 metric tons increase than what was reported in the previous year, making an earning of an extra 25 billion Kenya shillings to the citizens. The same is reported of what is happening in the dairy subsector. Mr. Speaker, there is more. The last topic actually that I'd wish to speak to is on this issue of the universal health coverage, Mr. Speaker. Under this program known as the Taifa Care, where citizens are now eligible for all services upon registration. And I like what the Ministry of Health is presently doing, where each week they release a county-by-county statistic of how many people have registered under Taifa Care. I think they do it every Tuesday or Wednesday. I saw for my county last week that they were actually at 19%. I urge senators to take in interest in your counties, because I saw there are counties that are still as low as 4 or 5%. And I believe it is the burden of you as a leader, because at the end of the day, Mr. Speaker, what is without contestation? You can argue about so many other things, this should have been done better or the other, but the testimonials that I have seen, Mr. Speaker, is that for those that have registered, Mr. Speaker, and be brought into this program, each time they have had an admission in hospital, Mr. Speaker, their bills have actually been sorted. And that is extremely important, Mr. Speaker, because you know for a fact that many ordinary families are just one illness away from poverty. And if you don't have a sufficient government program, Mr. Speaker, that covers people, especially during their times of illness, Mr. Speaker, we can render so many families destitute. And I want to challenge senators that speak to your people, Mr. Speaker, so that you appreciate and grow the numbers. It will be my greatest honor the day I push Kericho County to get to 80–90% of my citizens under Taifa Care, Mr. Speaker, so that I know for a fact that the issues of being invited anymore to fundraisers because citizens have gotten ill becomes a thing of the past, Mr. Speaker. That is the very essence of what UHC is about, Mr. Speaker. And I want to challenge many of us to take keen interest, especially our colleagues that serve in the health committee, so that you provide the necessary oversight on this particular program, ensure that the dream that we have of ensuring that we have a world-class healthcare system. Remember, Mr. Speaker, that we actually provided in the bills that we passed in Turkana for Facilities Improvement Fund, Mr. Speaker, meaning that the funds that are being collected in our hospitals from level 2 all the way to level 6, Mr. Speaker, are being utilized for the improvement and the welfare of that particular hospital. And it's not tenable anymore, Mr. Speaker, like used to be the case, where counties or even national government will collect funds and put them to other use to the detriment of that particular health facilities. It is important that we guide our people, Mr. Speaker, because remember, we provided actually for hospital administration committees at low as level 2, that dispensary that is outside your home, Mr. Speaker, that we provided it for in law under the FIF law, Mr. Speaker, for there to be committees that supervise the implementation of that particular program in that small dispensary. If we are not careful and we don't pay keen attention to it, Mr. Speaker, then you will find that Kenyans will do sometimes that which you are very good at, only that many times we just ask. We love accusing the political class of the same without necessarily taking time to ponder and reflect on it, Mr. Speaker. Is a fact that those monies can easily be lost if we don't put a keen eye, Mr. Speaker, to ensure that those charged with that particular responsibility respect and live up to it. There is a promise which the President made, and I have seen in social media circle today, somebody made a posting about the same, that they are actually a hospital owner. At the time of speaking to us, Mr. Speaker, the President says that SHA will actually pay all the October claims in full. I saw a posting today, and so many hospitals listed alongside it, having received payments, Mr. Speaker, and I need to verify because unfortunately we live in the days of social media, and there are skeptics all around us. There are those that will believe, there are those like Sifuna, you will have to show the actual payment statement, Mr. Speaker, for them to believe. But here is the point, Mr. Speaker, that who knew that there'd live to be a time where a public healthcare program, the card that you carry, would actually be more attractive to hospitals than the card of private insurance claim, Mr. Speaker, because I don't think even the private care that many of those that are well-to-do in society carry settle their claims that quickly. I must appreciate and record that, especially once it's confirmed that that is the case, that the hospitals that provided services for citizens in October have since been paid. With those very many remarks, Mr. Speaker, there are many things. I have only gotten to paragraph 34, but I have said I have to be a good example so that we are able to conclude. For those that came late into the House, we actually explained earlier of the need to cover this between today, tomorrow morning, and tomorrow afternoon, Mr. Speaker, so that we can carry on with other very critical business that we have to consider before the rise of the House next week on Thursday. Therefore, Mr. Speaker, while there are many other things that I have said, I'd wish to put a stop at that on the many programs and the things that have been exposed in the speech, and allow the rest perhaps to be spoken to by the rest of the members who will take time to speak to this particular speech, Mr. Speaker, so that you're able to conclude in the time. With those very many remarks, Mr. Speaker, I beg to move and request the majority whip, the Senator for Kakamega, Senator Dr. Boni Halwale, to second. I thank you.
Thank you, Senator. Boni Halwale, just one moment, please. I have a communication from the chair. Honorable Senators, in the public gallery, we have 7 persons from Migori County.